This is the Emergency Medical Minute.
Today I'm going to talk to you about something we don't see, but may. Rubeola. What's rubeola? Measles. Okay, viral illness, usually in childhood. Rarely see it in the United States, so there were 102 cases, 120 cases, something like that last year. We see about one case a year in Colorado. And there was one case in 14, one in 15, one in 16, one in 17. None reported to the CDC or the state as of September of this last year. We are, however, probably due for it. Colorado is one of 20 states that allows parents to opt out of immunizations for any reason whatsoever. Colorado is also dead last in the United States for states that have kids immunized in kindergarten. The normal immunization schedule for measles, mumps, rubella together is at 12 months and then at 5 years or so in kindergarten, but we are dead last in that. So there's a concern that we may see measles presenting. Measles, a viral illness, has about a 10-day prodrome. If you're exposed to measles, you have a 90% chance of getting it. It's spread through the oral droplets, and it can exist in the atmosphere for 2 hours. So if you have a case that you think in the waiting room, that means everybody who's potentially exposed has to be checked out for potential immunization or treatment. So a 10-day course of asymptomatic time where the virus is replicating in your body. You are not necessarily able to communicate that to anyone. But there is then a 3-day period where you have this kind of pathognomonic characteristic features clinically: cough, coryza. Thank you. What's coryza? Runny nose and conjunctivitis, with fever, and then what are called Koplick spots, K-O-P-L-I-K''S. They're little bluish-white spots that are adjacent to the molars on the buccal mucosa. Those present prior to any other rash. The rash typically starts at the hairline. It's maculopapular, goes down the face, then involves the trunk and the extremities. If you have someone who comes to triage with a rash and symptoms that sound like measles, realize that people are infectious for 3 days prior to the rash and 3 days after the rash. So any contacts, including yourselves, that may have exposure to those people because of the respiratory spread, need to be evaluated for treatment. The treatment, if you are exposed to someone and you've had your 2 vaccinations, you're good if you're not symptomatic. But the recommendation for live measles vaccine and the recommendation for immunoglobulin are a little bit different. If you're immunocompromised, if you're pregnant, if you're under 6 months, you get the immunoglobulin, and then you are also subject to quarantine for 21 days. And there's been a lot of talk of healthcare providers being involved in that as well. If you have received your vaccine and you're asymptomatic, then you're good to go. You don't need to be quarantined. So unlikely that anyone's going to see it, except for the fact that Colorado does lag behind every other state in immunization. So at some point, some kid's going to show up in some emergency department with measles. And that has a great potential to really shut down the healthcare, because healthcare workers are also that group that have to be quarantined for an extensive period of time.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.